GI bleeding. Gastrointestinal bleeding is a severe condition that requires medical attention. People should be familiar with the signs and symptoms and how to address them. In this video, we are going to make a brief overview so you are better prepared and equipped to handle it. The term GI bleed refers to gastrointestinal bleeding, a condition where there is bleeding from the mouth to the anus in the digestive system. These bleeds happen anywhere in the digestive system, including the esophagus, stomach, small intestine, large intestine, or rectum. The bleeding can be acute or chronic. Ulcers, gastritis, inflammatory bowel disease, diverticulitis, cancer, hemorrhoids, and some medications that can irritate or harm the lining of the digestive tract are just a few of the conditions that can result in GI bleeding. GI bleeding symptoms can include vomiting blood or a dark, coffee-like substance, passing black or bloody stools, and experiencing abdominal pain, weakness, dizziness, and fatigue. In extreme situations, it may result in shock or even death. Gastrointestinal bleeding is a serious medical condition that needs to be diagnosed and treated right away. Depending on the underlying cause of the bleeding, treatment may involve medication, surgery, or other measures to stop it and avoid further problems. It's crucial to get medical help right away if you experience symptoms. Early diagnosis and treatment of GI bleeding can save lives in serious medical emergencies. If you or someone you know experiences GI bleeding, you can follow these steps. Call for immediate emergency medical assistance if bleeding is severe or if the patient is experiencing symptoms like lightheadedness or fainting. Help the patient maintain their comfort and composure as they wait for medical assistance. Keep the person hydrated by encouraging them to sip on water or other clear liquids in small amounts if they can do so. Avoid taking any supplements or medications. Unless specifically instructed to do so by a healthcare professional, avoid giving the person any supplements or medications. Inform healthcare professionals. Be ready to inform healthcare professionals about the patient's medical history, current medications, and any other pertinent information. The cause and extent of a GI bleed determine the course of treatment. A GI bleed may occasionally stop on its own, but occasionally, it may require medical attention to stop the bleeding and avoid complications. Here are a few typical remedies for a GI bleed. Medication. Proton pump inhibitors or H2 blockers may be prescribed to lower stomach acid and encourage healing if the bleeding is due to an ulcer or inflammation. Endoscopy. An endoscopy procedure can be used to locate the bleeding source and stop it by cauterizing, injecting something that constricts blood vessels, or using clips or bands. Surgery may be required to stop the bleeding in severe cases or when endoscopy is ineffective. Blood transfusion. To replace lost blood and increase blood volume if the bleeding is severe, a blood transfusion may be required. Supportive care. To maintain hydration and avoid complications, supportive care such as IV fluids and electrolytes may be required in addition to medical interventions. Congratulations! You are now know the first-line thinking process to treating GI bleeds. If you enjoyed the video, please consider subscribing for more educational videos. Thanks for watching.